Ayesha Akhtar, Director of Education at the Epilepsy Foundation of Greater Chicago. Today, I have with me a really fun person, someone that I've worked with for so many years, and I'm really excited to have her with me today. She's the division head at the Pediatric Epilepsy Clinic at NorthShore University Health System, and also she is a board member of EFGC. So I want to welcome Dr. Takijah Heard. Thank you.
Thank you for having me.
Great. If you could just take a couple minutes just to introduce yourself and talk a little bit about your clinic, that would be great.
Okay, so yes, I am the division head of the epilepsy clinic and pediatric neurology at North Shore. And while we're there, we definitely service all of the pediatric healthcare needs as well as epilepsy needs. It has been a great honor because I feel like North Shore has done a wonderful job at ensuring the kids as well as anybody that is a North Shore patient has access to understanding more about COVID, testing, as well as those that are non-North Shore patients being able to get access to COVID testing. And so, you know, really proud to be a North Shore employee myself.
Now we are in the middle of this pandemic. So it's been about 3 months. What can you tell us about the landscape? What has changed dramatically? What are you seeing from your clinic? How has it changed the way you practice medicine?
Wow, since November, I mean, yeah, we sort of thought that that was something that was not going to affect us, but obviously you can see that it's now affected the United States more than any other country. It has totally revolutionized the way that we practice medicine. As you know, we sort of enjoy having a face-to-face visit with our physician, being able to actually put hands on to be able to touch the patient and do a complete physical exam face-to-face, but now we're doing completely and totally being safe by doing virtual visits. The virtual visits are, you know, very similar to what we're doing now. So Zoom visits, we oftentimes ask the parent to act as our assistant to get through many of the physical exam findings and the physical exam that we're asking the patient to complete to know that they have a normal neurologic exam. But it definitely still allows for a personal touch, especially with our established patients, to be able to see how they're doing, to be able to get a general idea of their mental state. And many of the patients have been very, very flexible and very, very appreciative of being able to continue with these virtual visits.
That's great for your existing patients. How does it work when you have new patients coming on board?
So for the new patients, that's where we have the more of the hands-on for the parents, you know, asking them to, you know, push the patient back further away from the camera for us to be able to see their body fully. And then we have to do a lot more from an observing standpoint. As you know, with neurology, a large portion of our exam is the observation of how they move, how their arms swing, how they speak, the amount of knowledge that they have whenever it comes down to understanding if they have a developmental delay or not. So we use the camera very similar to how we use our eyes whenever we're in the clinic with them. And so a few things we can't do, obviously, is like sort of getting a great idea of tone, because oftentimes we touch them to get tone. Reflexes, we can't do those. And then the general health exam, so listening to their heart or listening to their lungs, we can't do those things. However, a large portion of the neurologic exam is observation, and we can still do that whenever we have these video visits.
That's great. Do you think that that's something that might even continue on in the future? Like, I know you and I have talked about telemedicine. We're working on that bill, the telehealth bill. Do you think that that is a component that is lasting, or do you think that there will probably be a going away period for that?
No, I think that this new virtual visits are here to stay. I mean, the majority of my patients have explained that this is, you know, wildly quite flexible and convenient. They don't have to take the child out of school, although I know that we don't have school, but they do have to take them out of school if school was in. Oftentimes they'll have to drive them over. The moms and parents are oftentimes happy that they no longer have to find a babysitter or have to leave their child in the waiting room. And the timeliness, you know, so we have them set up just like any other appointment. You have a 3 o'clock appointment. We call at that time. The patient is there with the family member, and they're sitting side by side, and we're getting everything done in a timely fashion.
Yeah, that's actually something that I read is the rate of no-shows decreases dramatically in the
Absolutely.
telehealth model. So that's a great win for you. I'm really happy to hear that.
Yeah.
So let's talk a little bit now about sort of the landscape that we're in now, which is COVID, the coronavirus. I read a study on racial disparity in Europe. So they were comparing Northern Europe versus Southern Europe. Southern Europe having a greater incidence because of some of the intergenerational ways that families live together, and in Northern Europe, it's not so much. It's not as touchy-feely. So they were making some very interesting distinctions between Northern and Southern Europe. In the United States, we're finding the racial disparities in the African American community. And I was wondering if you could comment on that and talk about maybe why there is such a disparity. Is that community getting hit hard with COVID-19?
Yeah, so I think that once you sit back and you think of certain things, you'll actually understand it much better. It's not a genetic difference between African Americans and non-African Americans. It's more so the current state of where African Americans live, the current state of who African Americans work for. The majority of African Americans are the essential workers. They are the janitors, the healthcare workers that are in the senior living homes. They are the lunch care workers. They are the people that are still essential, the bus, transit, and subway workers. So all of the people that happen to be essential workers generally happen to be more African Americans. Furthermore, you can also think about the socioeconomic status of many African Americans, which may include the fact that they are, working sort of on an hourly basis. That hourly basis may not necessarily afford them the ability to not be in crowded spaces. So they're in, sort of tall high rises or areas that, there are multiple people in this small area. So they share a common doorway. That common doorway may not get the same level of cleaning that a group of people that are truly living in houses. Furthermore, whenever we think about the testing sites tend to be a little bit more so in the northern areas or areas where African Americans are not. Think about where we have our drive-throughs and our walk-ups. Those are not happening as often on the south side. Furthermore, I've definitely have heard anecdotal stories of African Americans that have had symptoms and have been turned away for testing. And I think our access to healthcare is definitely true, regardless of what that healthcare need is, but obviously shining or being highlighted during these COVID times. And then the one that I think that everybody has always been privy to is just the comorbidities. African Americans do have a higher incidence of comorbidities that will influence a higher incidence of developing COVID and dying from COVID. So if you have any type of respiratory or lung issues, cardio or cardiovascular disease, cardiac hypertension, then furthermore talking about diabetes, those unfortunately happen to be higher in the African American community. Furthermore, sort of thinking about some of the distrust that may sort of exist within the African American communities based on historical studies that we sort of already know about, like Tuskegee and those types of things, also add to the limitation of African Americans going to receive healthcare. That's a small proportion, but the larger proportion is the lack of empathy for African Americans whenever it comes down to them expressing their symptoms. An African American expressing the same symptoms using the same terminology as a non-African American, there's definitely a different level of action and a different level of critical need to assess and to treat them. And that's sort of something that has been going on, but unfortunately, knowing that COVID sort of gets to the patients quickly and knowing how to contain them, everybody should act relatively quickly, but I know that that's not necessarily what we've been doing as a community prior to COVID, and now it's very obvious now that COVID is existing.
Yeah, you touched on a lot of really great points, and I want to go back to the topic of comorbidities as well as access, because I think that that is especially key in the African American community. So if you were to design, and I know because you are such a positive go-getter kind of person, in your sort of utopia, what would that system look like? Or right now, if we had to kind of break down that barrier to access, how do you recommend communities, like you said, like physically, these testing sites are located on the north side. So a lot of African Americans who live in the south side, what do you recommend in terms of access to testing? How can we kind of overcome that barrier?
In the African American community, I think that, an area that could be a good testing site, could be, you know, a church, and having in the church parking lot. Many times the church parking lot happens to be in, you know, many African American communities. That could be the location where we have a drive-through. Obviously, we can also use the hospitals and their parking lots to be a drive-through location. But I think that that would be a good way to have people that are in the area to be aware that there's a drive-through. It happens to be, you know, 5 blocks away or not too far from this location. So drive-throughs and maybe some of the grocery stores would definitely be some ways in which we can get that access.
Yeah, that's a really great point. And I know as a South Asian, I know that the place of worship, the mosque, is definitely a place that drives a lot of people, community. So I think that the church idea is a really great one, and I would hope to see that in the future. Let's kind of take this conversation back to the world of epilepsy. I know having epilepsy is not a precondition for COVID, but I know that there are a lot of concerns for our people who are living with epilepsy. Can you talk a little bit about maybe some of the precautions families should take, kind of knowing that maybe there is a lack of access, there's an inability to get to a testing site, et cetera?
Yes. So for our, you know, kids and people that do have epilepsy, we do ask that, you know, you do what you can to try to keep them as safe and as healthy as possible. Those that do have epilepsy, whenever they are sick, it is a higher likelihood that their epilepsy and their seizures will increase in frequency. Now knowing that, you know, access exists, to testing, the best thing to do is to try to figure out where can you get testing in your local community. I work at NorthShore, and NorthShore has a way in which you can get testing if you're a NorthShore patient. But furthermore, it allows you to get testing if you're not a NorthShore patient. And this is simple by going to northshore.org. They have a COVID button at the very top. There you go through a list of questions about your fever, about any other symptoms of difficulty breathing, inability to taste. And then they sort of set you up to get drive-through testing, or to be actually seen, or to stay at home and continue to be monitored.
That's great. Thank you so much. Is there anything else that you wanted to share on the note of epilepsy, pediatrics, or COVID?
Just to, you know, let everybody know that if you do have epilepsy and you happen to contract COVID, we definitely want you to continue with taking your medications. Recognize that the normal respiratory distress that you experience because of your seizures may be heightened if you have COVID, and to make sure that you take that seriously. And then outside of that, do all you can to do the simple things to stay healthy and safe, washing your hands, washing surfaces that have been touched by many, and making sure that you sort of, you know, love thy neighbor and love yourself by staying at home and distancing 6 feet apart and not going out early to allow the curve to truly be bent and to go back down.
I think that's a positive message, and that's a great one to end this conversation on. So I wanted to thank you again, Dr. Heard, for visiting with me today. And I cannot wait to see you again in person in a restaurant downtown again and come full
Yes,
circle.
exactly.
See you again.
All right, no problem. My pleasure. I appreciate it.
Thank
Good
you.
seeing you, Ayesha.
Yeah, you too.